hematology, oncology, hemophilias, and vitamin K deficiency. All right, so for this audio, we're going to have hemophilia A, B, and C covered, as well as vitamin K deficiencies. And to start off with this, what we need to look at for all hemophilias, regardless of whether it's A, B, or C, is that we're going to have an increase in PTT. However, PT stays the same, okay? And the reason behind this is because there's a problem with an intrinsic pathway coagulation defect or factor, okay? And so hemophilia A has a defect or deficiency of factor 8. And the way that I remember it is A for 8, right? It's relatively easy. Number 2, hemophilia B, is going to be a deficiency of factor 9. The way that I remember that is benign, okay? And that is, once again, a problem with the intrinsic pathway, so that's why we're going to see an increase in PTT with no change in PT. And the common presentation is going to be hemorrhaging into the joints, okay? This is known as hemarthrosis, okay? And so you're going to have constant bleeding within the knee after a fall. You can see easy bruising or bleeding after trauma or surgery. The common presentation also is that they love to say that the patient could not stop bleeding after dental procedures. Lastly, for the hemophilias, we have to understand the way that it's transmitted, and it's due to the fact that it's X-linked recessive. So since it's X-linked recessive, you're never going to really see a female with it. It's always going to be a young male that's going to be having these issues. Next is going to be vitamin K deficiency. And the way that we can contrast our hemophilias with vitamin K deficiency is the fact that we have an increase in both PT and PTT. And the reason behind that is because we know that vitamin K uses epoxide reductase to be activated, and then it uses vitamin K to gamma carboxylate factors 2, 7, 9, 10. Since we have both 7 and 9 and 10 involved, as well as 2, that means both the intrinsic, extrinsic, and common pathways are all involved. Hence, if we have vitamin K deficiency, we're going to affect all pathways, leading to an increase in both PT and PTT. Bleeding time, however, will be normal.